Okay, well, in the interest of being respectful for your time, I'm just going to go ahead and get started. So thank you again for joining us today for welcome and welcome to health programming at your library. I'm Margie Shepard, the Community Engagement Coordinator for the Network of the National Library of Medicine, Region 3. So I have just a quick question for you. And I'd like all of you just to kind of consider this. When you think about health programming for your community, which picture on the slide most closely resembles how you feel about it? Put your response in the chat, and if you're up to it, add a little note on why. So A is some hands planting seeds in the soil. B is a raft in white water, which is quite terrifying to me. C is a large maze, which could be either intriguing or terrifying, depending how you feel about it. And D is a ballet dancer, which you can see they're really into the flow of their art. So, okay, we've got a pretty good representation for all of these. We've got lots of C's, lots of B's, A's, C, I'm not sure what I'm doing. Yes, I can totally get into some of these answers. Great. Well, go ahead and keep populating those. I appreciate it. I want to thank you for taking part in that and indulging us a little. But the reason that we do this is it shows us that we're all bring a lot of different feelings and experiences and expectations about planning and implementing health programming to our communities. So one thing about this class, it's not a full-on how-to, but we will provide information and resources to support you in getting started and maybe give you some new ideas about health programming. So in this session, we're going to discuss 4 particular things. First, why do libraries want to even conduct health outreach programming for libraries? So what's the purpose? Next, we're going to be creating an initial plan to help you with the development and implementation of health outreach programming for your library. And we're going to give you some ideas that range from really big to small. And also help you identify some potential partners for health programming and outreach in your library, because there's a lot of people in your community that you may not even think of when you're thinking about going down this road. And then lastly, we're going to help you identify some resources from the National Library of Medicine and other reputable agencies that can be used to support the implementation of health programming. So I just want to briefly introduce the Network of the National Library of Medicine, also known as NNLM. So as the name suggests, the NNLM is part of the National Library of Medicine, which is within the National Institutes of Health. So we are the education and outreach arm of the National Library of Medicine. We work regionally, getting to know communities on the ground and helping those communities serve the people that they know best. But we also are present across the entire country, and we work to advance the health and well-being of everyone through access and understanding of how to use health information. So this includes both working with organizations like libraries of all types, schools, healthcare, and all sorts of community-based organizations. So we do this through a couple of main ways. The first one is offering training and education opportunities just like this one, and through outreach and engagement. So at NNLM, our mission is to provide equal access to biomedical information to health professionals, but also we want to give access to quality health information to the general public so they're better able to make informed decisions about their health. So again, Rebecca's going to provide the link to that handout I mentioned earlier to help you guide you through today's presentation, as well as a link to the slides that I'm going to be showing you. So do check your download folder for both of those. All right, so I want to start with some more input from you. So there are a variety of ways to incorporate health outreach and programming into libraries, and it could be quite wide and varied. You could either be something passive or very active. So one example of a passive outreach program is to partner with a local nonprofit to provide free menstrual products that can be placed in the library. If you want to get into something more active, health programming might include a session for seniors about how to find reliable health information online. So if you would indulge me, have you seen anything lately or in the past that caught your eye about a program or a project that might be something you're interested in or you could share with all of us? So just drop that into the chat if you've seen anything like that. Okay, looks like nobody's seen anything. All right, well, I'm glad you're all here. What? Okay, oh, vaccination and blood drives. Princess in a Pad. Oh, that sounds pretty interesting. Oh, and great. Glad to see that, Day. They have period products. Okay, really great. Ooh, I like these. Okay, looking to partner with Health and Digital Life. So some really great ideas popping in through the chat. So I just want to remind you, if you see something, I encourage you just to kind of take a screenshot or copy and paste that because these are some really super great ideas. And some of them we will talk about as we move through today's presentation. So I'm getting some good ideas here. Great. Okay, I'm going to move on. Keep putting those in there so everyone can see them. All right, so you might be wondering, so why would a library be interested in doing health outreach? Well, you may or may not know this, but libraries obviously are oftentimes the hub for the community. So libraries across the country, and I just checked this recently, receive up to 4 million visits per day. So that's enough evidence for me to consider why we might want to get into this health outreach field. So also many consider the library to be the most trusted provider of information and community resources. And this also includes health information. Now, this statistic kind of dates back, but in 2016, Pew Research did a study that reported that 38% of the people that were using libraries did so to collect or seek out health information. And I'm sure that that percentage has gone up as health delivery has changed. So I also know that libraries have some existing partnerships and hopefully they also have local resources that are in tune with the needs of the community. So one of the reasons that we encourage people in libraries to offer health outreach is that in today's complex information environment, I view it, and I think a lot of people at NNLM believe this too, is that we have a bigger responsibility to communicate the resources and expertise that exist in our communities. So libraries, community centers, maybe faith-based organizations, they're often heavily utilized when someone has a question on just about any topic. And they're often the starting points for information seeking on a variety of topics, and this includes health. Providing current and timely health information also enhances the image and visibility of the library or the organization in the community, while offering health program helps keep libraries relevant to its users. Health events and resources also increase a library's visibility and inevitably shows the library's overall value to community members and leaders. And finally, an added bonus, when you adequately prepare for health programming and outreach, you are really getting in tune with the current health needs of your community that may change over time. So just a little quick note, when we think about where we are in the health outreach landscape and along with programming, I realize, it's not a one size fits all. I used to work in the public library sector in a rural library system in Kansas. And I know that my librarian friends are extremely ambitious people, and so we want to make sure that we know that ideas are not necessarily best practices, And you also need to stop and take a step back and consider your community and the library that you're in, and also consider your capacity. So we're going to talk about some of those things. I know there's a lot of challenges right now in the library landscape. So it might be, staff capacity. Maybe you're faced with some funding insecurity, and there could be some social and political pressures out there too that you have to consider. So all of these play into what you can and choose to offer. So, just be mindful that we're mindful of that as we go forward today. So if health outreach is new to you and your library organization, which I saw in the chat that it is for many of you, it is really helpful for you to begin by locating information on your community health needs, your community's health needs, excuse me. So this is a first competency of the Consumer Health Information Specialization from the Medical Library Association. So learning about the demographics, the health issues, the strengths and the challenges of your area can really help you create programs and outreach that really are spot on with your community. And they're also going to have the largest impact for your community. And I can tell you, grant funders also may, like if you're looking for some funding, this is one of the things that they're going to ask you for and look for is some sort of justification as to why the program that you're asking for funding is a good fit. So if you take care of this early on, not only are you going to be informed, but it's also going to check off one of those boxes when you're looking for funding. Okay. Also, I know that librarians and community advocates are really in tune with the needs of the community. But one of the things is while you might intellectually know this or feel this, it's really a good idea to step back and gather the data that you know that backs up the feeling or the observation that you already may have. So I'm going to give you some an overview of 3 resources for you to use to learn about the health needs of your community. So we're going to look at all 3 briefly, and then I'm going to give you a few minutes to explore them on your own, and then we'll come back and share some comments in the chat about what you found and maybe if you learned anything. So the first one here on this slide is called the State Health Facts, and this provides free, up-to-date, and easy-to-use health data for all 50 states, the District of Columbia, counties, territories, and other geographies. The data available comes from a wide variety of public and private sources, and this includes the Kaiser Family Foundation reports, public websites, government surveys, and reports and reports from private organizations. So this resource focuses on providing information at the state level. So for instance, if you discover, if you're thinking maybe diabetes or hypertension is a real problem, you can go on to this and find some health status indicators based on your state. And you can also find, for instance, the percentage of adults who've been told by a doctor that they have diabetes or heart disease or that they are at risk for this. So the second resource is probably one of my favorite ones out there, and it's called the County Health Rankings and Roadmaps. And this is a program that has been supported and created by the University of Wisconsin Population Health Institute with financial support from the Robert Wood Johnson Foundation. So this is a really excellent place to start looking for information about health issues that are drilled down to the county level. So it's very easy to search. All you need to do is put in your zip code, state or county, and then you can scan through data to get a sense of all the different information that's provided on the site. So here's an example of one of the things that you can find on this site. So I put Wyandotte County in Kansas into the search, and because that's where the University of Kansas Medical Center is located, which is where I am. And you can notice here that it pops up this information about the county population health and well-being. So right below, in the right-hand corner below where it says download chart, you can see Wyandotte County and how it stacks up against other counties in Kansas and other counties in the United States. So unfortunately, Wyandotte County is faring worse than the average county in Kansas for population health and well-being, and slightly worse than the average county in the nation. It's really, I'm only giving you a little snippet, but you're going to get a chance to look at this on your own. So if you look down below, I put in premature death as a population or a health outcome for us to look at. So it provides the definition of what it's showing you. So that it says in Wyandotte County, 11,500 years of life were lost due to death of people under the age of 75 per 100,000 people. And then as you go across, it compares it to Kansas counties and the United States. The arrow points to a little icon that if you want to further explore the trends in the metric, you can click on that symbol. Also below, it tells you when the measure was last updated. Some of the metrics on this site can be disaggregated by race and ethnicity to examine for health disparities as well. Here's one more snapshot that I wanted to share with you. If you want to fully look at some more problems or strengths and weaknesses or areas of some community conditions, you can do that on this site. So on this map, it shows where Wyandotte County community conditions, such as you can see the health infrastructure list, where it stacks up against Kansas counties and the national average. And I clicked, you can either click on the areas to explore or you can show the strengths. And I wanted to do both. So, Wyandotte County does have has a strength, and it has access to exercise opportunities. So that's really great. But unfortunately, preventable hospital stays and uninsured are woefully inadequate compared to other counties in Kansas and the United States. So if you want to, you can use these graphics by downloading charts, as part of your argument for why it's important for you to provide some sort of community outreach or programming in a library that addresses some of these needs. And finally, the last one I want to highlight here is the City Health Dashboard. So this allows you to see where the nation's 500 largest cities stand on 36 key measures of health and factors affecting health across 5 areas. And this includes health behaviors, social and economic factors, physical environment, health outcomes, and clinical care. So these also align with some of the categories that are used in the county health rankings and roadmaps. So I pulled up in this for our demonstration here today, the air pollution ozone metric for Denver. So the bar shows you how Denver compares to other cities in the dashboard. So it notes that a lower measure in this case is better. And if it's lower, it's going to include a green check mark in that circle if it's the value is better than average. And unfortunately, Denver is above the national average. So these dashboards are really, really rich. And I want to point out just a couple of things that you can discover when you're in there exploring them. So you can compare the certain health issues that are in the dashboard to other cities. So in this instance, one really great thing about Denver is that it has a lower rate of high blood pressure as compared to other people living in cities on the dashboard. So it has a green check mark. So that's good for Denver. Also, you can look at the physical environment issues that a city is faced with. So in Denver's case, it's a great walkable city and it has wonderful access to parks, but it struggles with the number of houses that are at risk for lead exposure. So you get the good and the bad. All right, so at this point, I'm going to give you some time to check these sites out. So just pick one of the resources that I mentioned, and just for a few minutes, I'd like you to explore it, put your town, your city, your county, whatever in, and then we're going to come back and you can share some of your findings in the chat. So I'd like to know which one you used and maybe one or two things that you found out, and being mindful that, look at it in terms of what's something that you could learn that you could be the start of a great programming idea. So I'm going to start my watch timer, and we'll come back here probably about 26 after or so, 27 after. Okay, as you're wrapping up your exploration, again, if you wouldn't mind putting that in the chat, because it's the best part about this is being able to share. I do want to mention the county health rankings and roadmap is undergoing some changes toward the end of 2026, but there's another resource that you might enjoy using and exploring on your own. And this is called the Congressional District Health Dashboard, and it is a companion to the City Health Dashboard. This dashboard was launched in January of 2023 as a first of its kind resource, and it's offering trusted data on health and its drivers for all 435 U.S. congressional districts and Washington, D.C. You can find the link to the dashboard on the handout, and I also think it's located at the bottom of the City Health Dashboard landing page as well. Okay, so I'm looking over here, and Dabney says there's quite a lot of concern in her area about children living in poverty. The county's doing worse than average. That was from the county health rankings. Michael learned about Allegheny County, where Pittsburgh is. It has a much higher average of dentists and primary care and mental health providers, even though it's really difficult to get an appointment. Let's see. We got some people noticing about premature death and only a third of the people getting flu shots. That's from Kelly. All right, so thank you so much for sharing that. I really appreciate it. And I hope that you learned something and can keep these resources in your back pocket or even bookmark them on your own website or on your own library website. Okay, so you've had a chance to kind of look at the community health needs. So the question might be, okay, now what? So for your initial planning, what I would suggest is that you first identify your intended or primary audience. So then you want to go on and consider what kind of outreach or programming that's appropriate for that particular audience. So, obviously teens would be extremely different than older adults. And I want you to keep in mind that health outreach does not mean that you have to provide a 1-hour program with the speaker and activities. You can think about the spectrum of engagement and what a manageable and meaningful outreach activity might look like based on your primary audience's needs. So it might be that people just want to come in and grab a flyer, or it might be highlighting a particular information resource, or you might even consider a one-time or ongoing programming. Or it could be maybe simply offering some training. So there's also quite a few options out there available. But again, I'm probably going to say this so many times throughout this, please consider the staff and physical space that you have available, as well as some other factors. So there are so many programming ideas out there that you can offer to address the needs of your community. But I wanted to highlight just a few categories just to kind of get you thinking about it if you're still kind of wondering. So food access. So this could be anything from a cooking program to gardening, or maybe if you have the capacity, offering a food pantry. I know some libraries in the summertime will offer their space for other community gardeners to bring excess food in and let people come and pick it up. I know one library in Kansas City did a program where they bought cooking utensils and created checkout kits, and then had an online community class to teach a cooking class. Movement, great topic. You could host a physical activity or even just set up a time for people to meet at the library to go out and take a walk, maybe have yoga. You could include chair yoga or even injury prevention for seniors. Access to care. It's a great inroad to health programming. You could partner with the health department for a vaccine clinic, maybe do some diabetes or heart disease training or education rather. You could have someone come in and talk about smoking cessation. There might be some support groups in your community that need a space to hold meetings. And also chronic disease management is also a very popular topic among people today. And I noticed some people talked about earlier about social work. Social workers being embedded in the library is becoming extremely popular. And you might be in a library that's too small to do this, but it's still something that it's to have on your radar. Librarians are oftentimes faced with people that are struggling with a lot of problems that we're just not equipped to address. So a lot of libraries are looking at ways to partner with other social services within their community to have, if not have a full-time social worker on staff, to have at least access to one occasionally. And then technology, during COVID, telehealth became very popular in the way that people could get appointments with their physicians. So maybe just if you can't have full-on telehealth services aren't available or you can't necessarily offer that, maybe just even talk about digital literacy projects in the realm of technology. Or if you have space, just a private room where people could go in with a computer and have an appointment. And then children and families, always a good category of people to consider when you're doing health programming. Sensory story times are very popular. Music and movement. Great opportunities, because I know one thing about kids, they're little sponges, and I always think it's kind of a trickle up thing. Once the kid learns it, they kind of transfer up to their caregivers, their parents, their siblings. So you can get a lot of people involved by just working with kids. Don't forget your veterinarian clinics in the area. When I lived in rural Kansas, there were vaccine clinics that were promoted by the library that took place at the fire department for animals, programs on pet first aid. And I know pet grief and loss is a huge thing. So helping people to learn about that and how they can get some comfort after they lose their buddy. You can also, don't forget your own resources, promote the information and reference services and collections that you have. Create a curated list of key or sensitive topics that you might have available. Always a good way to promote your library. So on this slide is a picture of some of the examples that, I just want to bring to your attention. So the Carnegie Library of Pittsburgh created these bookmarks to help teens find materials on sensitive topics without having to ask the library staff member where to find them. The bottom picture is the Central New York Library Resources Council. They offer the Healthy Pet Project, and this includes something that I never considered, but how to prepare for disasters with your pet. And then Teen Hygiene Health Center at the Rookwood Makerspace, and that's located at the Multnomah County Library in Oregon. Just a very simple place where they hung up things in the teen center to just make those things readily available for them. And a very aggressive thing is the Penn Hills Library Food Pantry in that picture at the top. And obviously they have the resources and place to have such a robust food pantry, which is cool. All right, so hopefully those ideas are getting your creative juices going. But also, here's some considerations to think as you're evaluating your ideas. So each community is very unique. So when you're making your case to offer health programming, always bear in mind what the unique need is for your community. In addition, to your intuition and observations, like I mentioned, gather that evidence of need, knowing that someone's going to ask you for it, be it administration, community leaders, funder. They're always going to want to know why you need it. And it's always easy to kind of have big ideas, but simple ideas and services are really a great place to start, and they're much easier for you to maintain. And ask us, it's a simple question is your project easy to explain? If you had to create a 10 or 15-second elevator speech, could you do that? I assure you that that's going to also help garner you support. And I also want to caution you, it was popular at one time to have these competitions like, teams to lose weight and all that stuff. Do avoid that. I think we're becoming much more aware, but that's a pretty sensitive topic, and to have a competition over health, I don't think that's necessarily a good idea. You want people coming to the table wanting to experience a healthy lifestyle because they want to, not because of a competition. Also, be mindful of who you're inviting. If you want to avoid people that are selling things like supplements or diet plans or, unproven cures, they're always looking for a place in the audience, or I'm sorry, in the library to have a captive audience. So do your homework on that one. And, you also want to make sure that in the instance, like I'm using the example of a registered dietitian versus a nutritionist. A registered dietitian is someone who has gone to school, they've taken a board exam or a test or what have you, and they're licensed, whereas a nutritionist, anyone can call themselves that. So do be careful. And again, when you're working with new partners, say, for instance, authors or speakers, there may be a spectrum of opinions and care out there. So you want to try to keep it as neutral and unbiased as possible. So here's just a few more quick, inspiring ideas out there. There was an article in Newsweek that talked about how libraries are having health hubs with food, fitness, and classes. I know, like the Lawrence Public Library that's close to in the community over from me has a nice section that's dedicated to health resources. That's just one local example. On this slide, the Menominee Falls Public Library, really easy partnership. They partnered with the American Heart Association to come in and do blood pressure readings. That's very easy, low-hanging fruit. People always are looking at a place to have that done, and easy for you to do. And then finally, the Cobb County, Georgia Library listed these events in December of 2024. So they offered yoga. They have vaccine clinics and Medicare counseling. All right, so if these stories don't have your wheels turning, I have a few more places that you can go for ideas. Some of you already probably have an idea, but if you don't, I just want to give you a few more places to go. And just briefly, I'm going to give you a brief description of the sites listed on the slide, and then we'll give you some time to check them out on your own. So the first one is Let's Move in Libraries, and many of you might be very familiar with this one. This program has ideas, resources, and examples of library programming that is focused around movement and active living. It also provides advice for where to begin, how to do accessible programming, and even information about liability. ALA offers the Programming Librarian. You can browse and search library programming ideas and examples, such as one example would be that you could search by your budget or maybe by your age group, and even search for health. And then it will return with some tips on planning, maybe some potential partners, marketing, budgeting, and other advice for carrying out the program. So it's a really great resource. And then Web Junction, Health Happens in Libraries. This program has formally kind of been retired, but the resources are still relevant. It offers dedicated resources to help develop health programming. So it has some webinars that you can look at, communication ideas, other detailed examples of projects. And it's a very deep resource and really very much worth exploring to make health programming a much lighter lift for you. The Rural Health Literacy Toolkit is a program clearinghouse that's specifically dedicated to rural libraries that are with the focus on health literacy. Ready.gov, great site to go if you're interested in doing some emergency preparedness training and programmings. It has social media toolkits that you can use without having to reinvent the wheel on that. Jayberry Storytime resources. When I was looking at this, I kind of got lost in it because they're so entertaining. But there's programs on food, movement, and information for story times with children of all ages. And then if you're still wondering about some projects, NNLM on our website has a list of past funded projects that talk about the target population and the project itself. And finally, National Health Observances has toolkits and resources from the Office of Disease Prevention and Health Promotion. These fall into the more raising awareness category, but if you just want to put up something very passive like a bulletin board for a particular month, this would be a great place to go to get information to do that. Okay, so now we're going to have activity 2. So all of these resources are linked in your handout. And I know that not everyone's interested in the same type of programming. So, just pick one or two of these resources that sound interesting or appeal to you. And just take a look at them. And if you don't already have a project in mind, maybe you could find an idea that you can use to think about for the remainder of today's presentation. So find that resource, think about your community, what you learned when you did the activity number 1, where you noticed or you found a health problem, and go from there. And I'm going to be quiet for about 4 minutes. So I'll be back speaking to you at about 1:47. So once you get some ideas or what have you, go ahead and put those in the chat so everyone can see them. I already have one from Dabney. She works with middle and high school students. Love the ideas from Let's Move in Libraries, focusing on music, dance, and live side board games. So one of the things that was very popular in the libraries that I used to go to when I was working with the system is story walks. You get people out there walking, and it's a really good activity for families. So that's one that's pretty easy to do. And I'm sure there's some instructions on how to do that. Okay, Kelly found gardening program ideas. One that stuck out was building a raised bed. That's great. I know it's probably, I'll just go ahead and add this before I move on, but one of the things that Region 3 funded when I first started is we gave funding to bring in a thing called Megalines to a rural a hospital and library in the middle of Kansas, where kids could go into communities and tour to see what the effects of vaping and smoking were. It was very popular. Okay. Great. Some really good. I'm glad you're finding some things. That's awesome. Great. Okay. Well, I'm going to go ahead and move on, but keep putting those in there. And again, you see something, just jot them down. Use them for the future. Okay. So we have our audience and we have an idea in mind. And I want you to start thinking about, okay, who can I partner with, to enable or enhance the outreach or programming activity? So one thing about partners is they might have some expertise or audience experience, or maybe some resources or materials that you don't have, that would certainly make a program extremely successful. So you also might be thinking, what on earth could our library possibly have to offer a potential partner? Well, one thing is a lot of local organizations who have the same goals that a library does, but they may need some space, or they also may need the community connections that a library can offer. So that's one really great thing. And sometimes for them, it's the ability to reach a bigger population by coming to the library. So for instance, if the health department is trying to do some education, or, just to get some information out about their programming, they may be a perfect fit to come in and do a presentation on, say, nutrition, or anything about, maybe for well baby care or something to that effect. So there's a few types of partnerships that you can consider. For instance, the local government or public health offices. So I mentioned them. Great place to start. They're especially interested in keeping the community healthy. The library of your community college or university, great partner, unless that's where you are. If you're in one of those settings, partner with your local public library. And healthcare providers. They're going to know what is most important right now going on. So for instance, right now we're in very heavy flu season. So while they may not be coming to the library, they might be able to help you create some information that you could hand out to people in the form of a bookmark or what have you. Food banks, ag nonprofits, or SNAP educators always have great resources out there. I know some agricultural nonprofits might come in and do some mental health presentations for people that work in the ag field. Cooperatives or local extension bureaus, they're great. I loved the Extension Bureau when I was in rural Kansas. They would come in and do programs on food safety, especially around Christmas and the holidays, nutrition, maybe mental health, aging, and more. Is anybody out there ever worked with a co-op or a county extension agency? If you have, popped it in the chat because that shows that they're really being utilized. Yeah, great. Katie has. Yep, I think they're wonderful. Okay, we do Wick Farmers Market. Awesome. Yep, great. I love to hear that. And finally, there might be some local authors or businesses that might be interested too as a partner. Oh, great. Many fire departments have community paramedic or service coordinator to partner with. That's great. Great ideas. We're getting some really super ideas. Oh, I love seed gardening series and seed libraries. Health fairs, great ideas. Okay, so here's an example of a partnership that was, what I think is really interesting, and it really focuses on what I talked about is, in librarians who really take, charge and make a difference. So the Brooklyn Public Library at the Central Branch, one of the librarians noticed that people in the community, young women, were experiencing period poverty. And according to period.org, in 2025, 24% of teens in the U.S. struggled to afford period products. And a third of the teens reported missing at least 15 minutes of class from lack of these products. So statistics also show that students of color, lower income students, and those living in rural places are most impacted by the lack of access to menstrual hygiene products. So what the library did is they partnered with a nonprofit called the Cycle Alliance to start up a period pantry. So this resource provides products, and what they took it a step further at the library, and they provided some educational materials and information about reproductive health. So that was, taking one idea and expanding it to make it even have a broader impact. So this next one is an example of where a community identified a need, the library developed a project, and they found partners and funding to meet the needs. So if you'll bear with me, we're going to listen to about a 3-minute video here, and then you can share your thoughts about it in the chat.
In Pottsboro, Texas, a rural community 90 miles north of Dallas, people have to travel to get to the doctor, and that's difficult for a lot of people here, and it's time consuming. There's no public transportation, nor is there any ride sharing available. So we stayed open throughout the pandemic so people could come here because people didn't have computers or internet subscriptions at home. Then we started getting a couple calls from people who wanted to have doctor's appointments. Libraries are perfectly positioned to work with telehealth because we're oftentimes the fastest internet connection in town. People trust librarians. It's a neutral space. We're accustomed to helping people with digital literacy skills. So it all came together to request funding to start a virtual health room here.
The original proposal that they pitched was to create a pilot telehealth site that would allow them to figure out best practices that they could distribute as a model to other libraries or other community organizations that are looking to do the same thing. And in that respect, it has been a resounding success. A crucial partner in this was also HSC Health, which is sort of the clinical support that they got for managing schedules, for setting up appointments with providers.
So as it stands right now, there are 77 counties that don't have a hospital. Telemedicine can be a real solution to a lot of these problems if we have both the equipment, and then you have to have someone special there to help lead the way and to acknowledge that it's actually safe.
NNLM made it possible for us to convert this old storage room filled with old books into a virtual health room, a room where people can come in, connect with healthcare providers, get the care they need closer to home. It's leading to people being healthier.
During COVID, I did not want to go sit in a doctor's office and expose myself to bigger things when I just had a minor health issue. So this made it where my safety came first, and it was private, easy, convenient. That's why I chose it.
It's a great model, and in fact, we've created a playbook because this is not about secret sauce. This is about let's make our communities healthier. Here's what we learned from this experience, and here's what we wish we had done a little bit differently. How fabulous would it be if all rural communities had this kind of access? Healthy people become healthy communities.
Whenever Pottsboro, Texas is on national news, I know we've done something worthwhile. And I am proud of being the first pioneer to do this, to be able to help other libraries across the country make this happen. And it's a reality now that would not have happened without NNLM.
Okay, so I just really wanted to share that with you because it's kind of a really interesting project. And while it's a bigger scale than a lot of you may want to take on, it's certainly good to point it out. So if you have any thoughts about it or anything that you want to say, go ahead and pop that in the chat, but we'll go on. So, after you get your community health stats and you brainstormed some ideas, it's time to sit down and kind of fill out some details to help this idea to be realized. So we're going to share 2 ideas for formulating a plan, and then you can choose which one best align with your organization. So first of you might have heard of this before. It's called the 7 key questions. And what this does is it helps you think through the development of your activity. And there's 3 questions that you can ask yourself. And some of the questions are multifaceted, but they're probably going to help you recognize what pieces you have in place and where you will need to fill in the gaps. So the first one is a who. So think about who your primary audience will be. We talked about that. Who in your organization can assist the planning of the program, and who in your community might be an expert or even know an expert, and who might be a potential partner for the event. And then the what, what type of outreach activity could you provide? Will you provide information? Are you going to do a program with a speaker? What community needs will you be addressing? And do you have the evidence? And what resources are you going to use? When? So when are you going to offer the program? When should you schedule it so that your audience and your staff are available? Is this going to be a one-time event, or will it coincide with like a health awareness month or something else that's going on in the community? And where are you going to have your activity or program? Do you have the space? Would it be better to conduct this at a senior center or a school, depending on your audience? And is it accessible? Is the place that you chose, is it accessible to participants? And then why? So why do you want to offer this activity? And why will this benefit your library or organization? And then the how, how will you market the program? Are there specific locations where your ideal audience frequents? And how will you locate a speaker if you're unaware of any? And finally, how much? This question involves how much time it will take. Other staff, do they have time to invest in it? And how much money will it cost? Okay, so I know that's quite a bit to digest. So, I'm going to show you one more tool, then you can kind of think about if this would be a good way for you to address your program. So some of you may have already heard of this. When you need buy-in from funders or stakeholders, using a logic model is a really good way to explain your project. So you can use reactions or put this in the chat if you've used a logic model or not. I have used them on occasion. So yeah, they do serve a purpose. So what it is kind of a visual representation, or it could be a map of a program that illustrates how the planned activities are linked to the results that you want to achieve. So if it's really well constructed, this logic model can make it really easy for you to plan outreach by helping you determine like the resources and activities that you need to achieve a desired result. As complicated as it may sound, it could be easy to use and really helpful from a program idea, getting it all the way to the evaluation stage. So it just really helps kind of map out whether or not this is even going to be possible. So you can think of those inputs that you see up there as the resources that are going to be used to support the activity or program. And the activities are the main things that what you will do and who you're going to reach. And then the outcomes are often, there could be quite a few. So some of these can be observable or tangible, short-term, intermediate, and long-term. And then I want you to pay attention to the bottom there. So the assumptions or beliefs about the environment and the community, and the external factors include the positive and negative influences. So let's say, maybe the culture is a little bit difficult right now in your community for a particular project, or the economics or the politics or demographics might be problematic. So, both the assumptions and the external factors really should be concerned before you even launch into a project. So here's a template that you can look at. I mean, it shows some of the things in each area that you could consider that would go under these particular columns. So there's a place, for the program, and then the goals, etc. So just to give you a little bit of an idea of some of those things that might impact your map of your project here. So logic models don't have to be hard or daunting. So here's a very simplified version of a story time logic model that we got from the Library Research Service. So you can think of them as like if-then statements. So if we do have the things in the inputs and activity side, then we can predict the outcome side. And a lot of people use a logic model to go from the end result and work backwards. So for instance, in this instance, we look at this is the outcome that we want to achieve. We want caregivers and children to learn early literacy skills. So we're going to do that by offering storytime instruction with the goal of having 15 people and so on and so forth. So just a lot of people like to work backwards. So if this way of planning appeals to you, there's so many resources out there on how to develop logic models. Okay, so this is your turn. You can choose either the 7-question or the logic model, and the handout has these, and kind of filling them in. And I'll be quiet for just a couple minutes, just for you to kind of look at them. And, I'm going to just be curious which one that you chose, and kind of if you could provide me with some answers or comments, like which one did you use? What did you think? And how did it go? So if you wouldn't mind just putting in the chat, which one of these models appeals to you, I'd appreciate it. Just so I can get an idea if, yeah, it is very specific in the logic model. Yep, 7 questions works too. I think with 7 questions, you might find that you've already had the answer to some of them, and it just helps to kind of guide you and, I didn't really necessarily think of that. Yeah, and logic models are I kind of feel like they can stops you from getting into something that may be too much or that may not have a good result if it kind of meets some of those things, like if you have some barriers that you didn't think about. Oh, and some people work both. Yeah, I can imagine using both. So you can use the 7 questions to develop the ideas and then put it down in the logic model. That's great. Well, I hope, yeah, you can use that logic model. And I think there's a link on the handout about where to get more information about logic models as well. So um, good. Well, I'm glad you found a couple ways to help with your planning here. Okay. Okay, so now we have the program activity and it's coming into focus. I just want to briefly talk about how you're going to get that information out to, yeah, AI can help with that. We can't forget AI. So anyway, I just want to talk about how marketing can come into play when you want to get the information out to the people that you want to reach. So does anybody have any marketing ideas that have already worked for you in your library, or maybe that you've seen? What works best in your area? Go ahead and put those in the chat. I know so many libraries use, like if you're a smaller public library, maybe use social media, maybe use Facebook or something like that. Maybe if you're an academic library, you rely heavily on your website. Just pop those in. Yeah, some people email, newsletter, widest reach. That's great. So, some of the, sometimes once, so for me, once I've identified who I'm going to do this program for, I kind of think about, well, where do they usually frequent in a community or in an academic setting? So for instance, rec centers or senior centers or schools. So what areas maybe are in your school or your academic area are the audience likely to be in? It can sometimes be a process of trial and error, trying to determine what marketing strategies are going to work the best for your community. But again, we see some of these in the chat, using social media, flyers, emails, tapping into community partners, listing things on the website. If you have a partnership with a radio station, maybe doing a press release or news feeds, those are really good ideas or ways to get the word out. Schools that can send things out to parents. That's a great way to get the news out. And remember, marketing doesn't have to be like just within the walls of your libraries. We're seeing some of the examples that are pointed out in the chat. And also, if you are using your library, maybe, put some additional signage in some places that you maybe didn't think of. I know the end caps of, if you still have quite a few books in your library, those end caps are great to, put up a flyer about an event. You might catch a casual browser. And don't forget, power of the word of mouth and personal invitations. I can say too, some of the things that we do at NNLM I see on our state library website, that they've somehow found a program that we're offering, and we have a large audience that it reaches out when the state of Kansas does that, and I truly appreciate it. Okay, rolling screensaver, I love that. That's awesome. Announcements. Yep, I like the 4x6 flyers. That's great. Oh, on the bookshelf, terrific. Good use of some space that may not be used on a regular basis. A lot of the National Institutes of Health have digital materials too that you can use. They're free to reuse. You can go to the site and look under community outreach or materials on their website, and they're free for you to download and print and use as you see fit to support your programming. Here's another example of one. It's about depression and anxiety, and it's from the National Institute of Child Health and Human Development. It has a poster that's downloadable, and both in English and Spanish. So the great resources out there from NLM and NIH. So also, we don't want you to have to start from scratch, to create a program. That can be a lot of work. It's worthwhile, but again, having a jump start is always, it's always important to me for time saving. So I'm just going to share a couple of resources from NLM and NNLM that can help you, give you a little bit of a head start. So we partner with quite a few organizations to offer programs. One of my favorite is one that focuses on citizen science or community science. And this is and I don't know how many of you are familiar with it, but that's participation by the public to aid in real science research and discovery. So NLM has developed resources along with SciStarter, which is the organization that we have a really great partnership with, and they work on advancing engagement from the public in research. SciStarter has a directory of projects. A lot of them even have a module that's geared toward libraries and public libraries in general, about how to bring citizen science into their library. They have projects that range from bird and insect counts, from light pollution, animal behavior surveys, gamified research on Alzheimer's, and much, much more. And the month of April is dedicated to Citizen Science Month, and SciStarter has done this work since 2016. So if you're interested in seeing what's coming up in April, go ahead and go onto their site. I'm sure they're already starting work for Citizen Science Month. So NNLM has developed an online toolkit to also help busy library staff host one of the most popular things that happen in libraries, and this is a reading club. So our reading club offers a curated list of health-themed books from a variety of genres to facilitate conversations on health and wellness topics. So by reading different health topics in a safe setting, people can learn about health information, reducing the stigma surrounding some diseases or health conditions. So the topics range from menopause to diabetes to caregiving to environmental health. There's a topic pages that has resources, videos, and fact sheets for the topic. The book suggestions are in all different genres: fiction, memoirs, graphic novels, young adults, poetry, and even short stories. So here's an example of one of the books that are in the list. This is called My Father's Brain, and it has a section about what the book is about the author, and then how to host your discussion. It already has the discussion guide, the social media, JPEG, posters, and a bookmark. It makes it easy for you to host. Also, NLM has a variety of other resources to help you design and implement health programs. There are some bookmarks that you can download for free. Here's one on Medline Plus. There's proposal writing toolkit to help you if you're trying to write a grant. There's resources for public libraries, some community engagement resource guide, and a mental health information partnership, community partnership toolkit. Okay, and congratulations. This class earns you 1.5 credits toward a consumer health information specialization. So CHIS, or the acronym is CHIS, is professional development program that goes through the Medical Library Association that can help you gain skills in areas such as understanding your community, like we did today, finding and evaluating health information resources, and improving health literacy. When you take a class like you did today, you can earn credits toward this specialization. So one thing that stops a lot of library staff from getting into health information outreach is that feeling like they don't know enough about it or have the resources to respond to a question. So this program will help you with those skills and also provide you recognition that you've gone through and done the work to get a specialization. Okay, so throughout the year, we also, NNLM offers classes and trainings in a lot of formats to help you achieve this. So we've got on demand. There are many, many recorded webinar sessions that you can take at your own convenience, and our classes are always free. There is an application fee through MLA for specialization, but NNLM can help you with reimbursement on that. We have a limited number of opportunities available, so you can check that out I think there might be a link on our handout. If you get this specialization, you can do it on your own, or you can do it with a great group. And if you do that, it's something that your library can promote as another service to the community. So I'm going to wrap up here. One of the things I want to encourage you to do is, to learn more about it, think about what we've talked about today. Just pick one or two things that, maybe stood out to you. What are the next steps that you could take? Just kind of give it a little thought, reflect on how you can take what you've learned today and go forward. Let's see. Is there any questions, Rebecca?
Well, W. Smith just sent a question to you and I about, and I have to admit, I am not sure how all the CHIS credits work.
Oh, okay.
If you do, Margie.
Well, yeah, right. So while the competencies within each of there are 12, there's different competencies, and you can get credits in the different combinations to achieve the levels. So I encourage you to go onto the MLA website and read a little bit more about that. Sometimes you can take, when I got my CHIS, I took one class and it covered everything, but it was an all-day thing. But feel free at the end. I'll share my contact information. If you want to shoot me an email, I can give you a little bit more information about that. There's level 1 and level 2. Level 2 gets a little bit deeper into some of the more things like health literacy. So feel free to reach out to me and I'll help you with that.
Now, I will say that page 4, I'm looking, page 4, the last page of the handout does have links, learn about CHIS and find CHIS classes. So that's on the NNLM website, and it does say which competencies this class covered.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.